Now, from the News Channel 5 network, this is Medical Mondays.
And good evening, everyone. Rory Johnston here, your host tonight for Medical Mondays on News Channel 5 Plus. Thanks so much for tuning us in. For the next hour, we are speaking with a local expert on a specific topic, and it's your chance to call in and talk directly with the doctor. And tonight, we're pleased to welcome Dr. Tiff Siragusa, who's here from the Siragusa Vein and Laser Center. Doc, thanks for being here. We really appreciate it. Thanks so much. We're going to be talking about all things veins. He is a vascular surgeon, vein disorders, and cosmetic treatments. So don't be shy about calling us in at calling in at 737 plus everyone 737-7587. All right. We have some also before and after varicose veins and spider vein pictures that we're going to show you throughout the night so the doctor can talk about it and really give us some specific examples.
Sure.
What does a vascular surgeon do? And what do you...
Yeah, so a vascular surgeon is specially trained to deal with all the circulation in the body. And that really comes with two forms, arteries and veins.
Right.
So arteries deliver blood away from the heart to the brain. For instance, the carotid artery delivers blood to the brain. And when there are problems with the carotid artery, people can have a stroke.
Right.
The aorta, which is the main blood vessel down in the belly, can dilate and become an aneurysm. And when those get too big, they can pop and are very fatal.
So very, beyond the cosmetic aspects, these are very serious medical conditions that we're talking about, right?
And when it comes to veins, the typical problems that people have with their veins is in the legs. And those come in the form of spider veins, which are flat, discolored areas of patchy veins, and varicose veins, which are the bulgy ones that you can stick out and you can feel through the skin.
Mm-hmm. What are the treatments like? I mean, when we talk about the leg, the spider veins, varicose veins, here in the year 2015, we hear so much about the advancements, treatments for these issues.
Right. Well, for spider veins, the mainstay in treating those is injections. Mm-hmm. And there are two FDA-approved medications to inject spider veins with that work very well. Traditionally, people used a strong salt water to inject them, which worked on about half the veins that were injected, but caused a lot of burning, a lot of pain, and a lot of side effects like discoloration. Mm-hmm. Today's medications that are available do a much better job. With varicose veins, traditional surgery involved a 2 to 3 day stay in the hospital, several incisions on the leg, and today's therapies, which involve radiofrequency, heat, and lasers, really take about 10 minutes, are done on an outpatient basis, and people go about their daily business as soon as you're done.
Lasers really have been a game changer, haven't they?
Yeah, the lasers have been used in a lot of different forms of surgery and medicine, and with veins, they really did help change the entire landscape on how we treat this problem.
Mm-hmm. So as a vascular surgeon, you're dealing with all sorts of issues then on a day-to-day basis, right?
Yes.
And instead of just focusing on one issue.
Right, and one of the more common areas that we focus on as vascular surgeons is the legs. We see a lot of people don't know what is wrong with their legs. They know they have pain, mm-hmm. or they have leg swelling, or their legs don't look normal, or maybe they have a wound that's not healing as quickly as it should heal if things were normal. And we evaluate a lot of these problems and oftentimes find an issue in the circulation that can be corrected to help solve their problems.
Mm-hmm. Excellent. 737 plus rather is the phone number if you would like to call in. We have one caller on hold right now. Hang in there, and of course we're expecting more. We'd love for you to call in tonight as we discuss vein disorders and cosmetic treatments with Dr. Siragusa. What are the most common things that people come to you for? Would it be the leg issues, and is it mostly women?
It is mostly women. It's probably about 2/3 or so women and about 1/3 men. Men typically will come into the office at their request or after they're dragged in by their wife or significant other.
Okay.
And their problems are usually a little bit more advanced by the time they seek help for it.
Because men, we don't like going to the doctor.
We're busy.
Right?
We just have aches and pains and just would rather just deal with it than take any chances on finding out what it really is.
Right, no doubt. All right, let's go to the phones and welcome Carl. Hey, Carl.
Yes.
Welcome, sir. What's on your mind?
I'm doctor. I took me off cholesterol medicine there, and supposed to take it off for 2 weeks, and they put me on some blood thinner.
Yeah.
And my hips and legs, they just ache. Just hurt all the time.
What was the aching in your hips and legs? Did that come about after you started the cholesterol medication?
No, back when I mean, it's been about 8 years ago and stuff. I broke my back and stuff, and I had 3 stents put in my heart, and they put me on that cholesterol medicine. But the last year and a half and stuff, I've been having a lot of problems, and I'm trying to get the doctor and stuff, And,
Sure. Well, a common problem that people can have who have heart disease, that have stents in their heart, they can also have blockages in their legs. And blockages in the legs can cause crampy pain, mainly when you're walking. The muscles of the legs do okay when you're just sitting down or laying down because they don't demand very much oxygen just to be at rest. But when you get up and walk, you reach a point where you're not able to get enough blood flow to those muscles, and they ache and hurt you. And that's something that's readily assessed with an ultrasound.
What are the typical kind of assessment tests that you do when a patient comes in?
When patients come in primarily with leg complaints, we do an ultrasound. And the ultrasound is a great diagnostic tool for vascular problems because there's no radiation, there's no IV necessary to give any contrast. It's pain-free, takes about 30 to 45 minutes, and the information that we get from an ultrasound tells us if there are any blood clots present, tells us if the blood's flowing, in which direction the blood is flowing, which is important with varicose vein disease, and it also tells us in the arteries if there are any blockages.
All right, Carl, thank you very much. Let's go to Polly next, who's on line 2. Hi, Polly.
Hi, how are you doing?
Doing well. What's on your mind?
I'm having problems with my legs.
Okay.
I have had quite a bit of surgeries. All my knees, my hips, everything have been replaced, and they claim that that's why my legs are not holding up. Just lately, my toes will turn. I sit down, my toes will turn black.
Wow.
And I'm wondering if that has anything, well, of course it has to do with circulation, and I'd like to know if he could help me.
Well, Polly, a lot of patients that we see have had surgery on their hips or knees before. A lot of patients have other problems like back problems that can cause leg pain. And, everything.
I don't have any pain.
Okay, just discoloration?
Just a discoloration? Okay, hold on.
Well,
We're on hold for a second.
Yeah, and the discoloration is often a sign of blood flow problems, either not getting enough blood to the leg or trouble getting the blood that is delivered back out, and your leg can become darker or blue or like she's describing, black.
That's got to be frightening.
It is.
First of all, to see that.
Yeah,
right?
yeah, and oftentimes it's just a problem with the smaller blood vessels in the legs that really aren't going to lead to any problems, but a lot of times you get some peace of mind with having an ultrasound and having a test and coming in and being reassured that it really is not anything that you have to worry about.
Okay.
Yeah.
All right. Thank you, Polly, and thank you to Carl. And we have wide open phone lines if you'd like to call in now at 737+. Thrombosis and insufficiency, 2 main categories of vein disease, right?
Right.
Thrombosis I've heard of, but when you just say insufficiency, maybe go over both of them a little bit for us.
Yeah. So veins have one job, which is the leg veins, that is, have one job, which is to bring blood from our legs back up to our heart.
Right.
And it's a pretty difficult job with gravity trying to keep all the blood down in our legs. So veins are equipped with valves on the inside. The valves open to allow blood flow upward, but then they close to not allow that blood to come back down. If those valves don't work properly, it sets up what's called venous insufficiency, which means in that particular vein, the blood's moving backwards, back down into the leg and out its branches. And that underlying problem is what sets people up for varicose veins, spider veins, and even skin ulcers in extreme cases.
Yeah, I was going to say then what happens to, say, the lower leg and the feet? Do they swell? Do they what? I mean.
Right, if you can't get that blood that's being delivered to the leg out, the legs will swell, and depending on the territory of skin that's literally being drained by that particular vein, you can have discoloration, you can have extensive spider veins in that area, and also skin breakdown where you have an open sore. Thrombosis is when you actually develop a clot inside of the vein. So the valves are working fine, you just develop a very soft clot in the vein, which acts like a roadblock. All the blood's trying to come out, but now with this clot sitting in the vein, it can't get past there, so you develop swelling and pain. That's often on one side. It's often after a long car ride, after a period of immobilization like surgery, and it's a very very common cause of disability and death in the United States.
Right. This is what we hear about long plane rides, international plane rides, the importance of getting up,
Right.
moving around,
Right.
stretching, getting some movement instead of just sitting in one place.
And it can happen at any age. Serena Williams, for instance, had a blood clot after a continental flight. And
Right.
was pretty sick from that.
Pretty scary.
Yeah.
Okay. With that, we're going to take our first break, everyone. Come back with more of your phone calls. 737+ if you'd like to call in tonight on Medical Mondays. We'll be right back. We're back on a Monday, Medical Mondays, here on News Channel 5 Plus. I'm Rory Johnston, along with Dr. Tiff Siragusa, who is our guest tonight as we talk about vein disorders and the cosmetic treatments for veins. Your chance to call in at 737 plus. That's 737-7587. Wide open lines right now if you'd like to join in the discussion. We were talking about what is vein disease in general. We talked about thrombosis and insufficiency, but there are actually two types of thrombosis, right? I'm looking at my notes here. I'm going to see if I can say this correctly, Doc. Superficial thrombophlebitis, is that right?
Phlebitis.
Phlebitis, thank you. Yes. Thrombophlebitis and deep vein thrombosis.
Right.
Take us to,
Yeah.
these
so
differences.
when it comes to the veins in our legs,
Yeah.
they're drainage systems. They drain
Right,
blood.
like you
there's two systems. There's really the group of veins that drain blood from our skin, and then there's another group of veins, the deep veins, that drain the blood that has delivered oxygen and nutrients to our muscles. Now, the deep veins take probably 80% of the blood out of the leg for our body. The superficial veins deal with about 20%. And so, depending where that clot is, determines if it's something dangerous or something that's more just painful and annoying. So when you develop superficial thrombophlebitis, that's developing a blood clot in the superficial veins of the leg, which are just right under the skin. And that can lead to an area that is often mistaken for an infection because it becomes red, swollen, and tender. And a lot of times people go in with this problem and are treated with antibiotics, which really is not the right way to treat clots. This kind of problem really doesn't lead to any long-term problems. Now, clots in the deep veins, deep vein thrombosis, that's developing a clot in one of the main veins in the leg that delivers 80% of the blood out. And the flow through those veins is very fast and they're very large. So if you have a clot in your deep veins, it can cause two sets of problems. One relates to your leg. It can cause chronic swelling, it can cause a lot of pain, especially when you exercise. It can cause a lot of pain as you deliver more blood. That blood can't come out and your leg swells and hurts. That clot can also break off and travel to your lungs, where it can cause what's called a pulmonary embolism. And those can be oftentimes fatal. Smaller pulmonary emboli, which are not fatal, can also lead to long-term shortness of breath and chest pain. So that's a much more serious.
Why is it fatal? What exactly happens when it gets to your lung?
Yeah, so the blood carries this clot back through the veins, and then remember, this is all what we call old blood that has no oxygen in it. It needs to pick up more oxygen in the lungs. So the way it gets there is it travels up into the heart, travels through the heart, and then to the lungs to pick up oxygen and drop off carbon dioxide. So the branches that go to the lungs are just like tree branches. They get smaller the further you get out. If you have a clot that goes into the heart, out the heart, into one of those branches, if it's a big clot, it gets stuck in the main trunk of that branch. So you could effectively cut off blood flow to an entire lung. If they're smaller, they can go out into smaller branches. But if you're not able to get this blood into your lungs to pick up oxygen, then you're not able to deliver oxygen to the rest of your body, and it can be a major problem.
That's when we hear about some of these incidents. Wow. All right, 737+ if you'd like to call in. Let's see what Tom has in mind. Hey, Tom.
Hey, how's it going?
Going well. How are you? Go ahead, sir.
Yes, I wanted to find out about cancer in the lymph nodes and how it flows through the body. My daddy died at 49, and my son's got like a mass on the back of his neck.
Wow.
Okay. Well, any mass, especially in the neck, should be evaluated by usually a specialist, an ear, nose, and throat doctor, or an oral surgeon.
Right.
That evaluation will start with a good physical examination, feeling on the neck and examining the rest of the lymph nodes in the body, and it'll probably be followed by a CAT scan of the neck that will determine if there are any other problems that you can't see just by observing. And most oftentimes, especially in someone with a family history of cancer, what will be recommended is at least a biopsy of the swollen lymph node or the area where the mass is to make sure that it's not cancer.
Yeah. All right. Thank you, Tom, for calling in. As we look at the cosmetic side of this, and just that, when your health is really not at risk, but it's just the cosmetic, you don't like the look of the veins on your legs or wherever they may be. How effective is the treatment now, and what can be done?
Well, vein disease is really most of it has a cosmetic component to it because it's visible. And as that problem progresses, most people, the way they describe the way they feel about their legs, most people will say, well, initially I noticed these veins there, but my legs felt great. Sure, they were ugly. I didn't like to wear shorts or dresses, but it really didn't bother me. A few years go by, those veins become larger. They still really don't hurt, but they're bigger and more of a cosmetic concern. And then eventually they become painful and patients will develop itching of the skin overlying the veins, swelling, oftentimes leg fatigue or restless leg syndrome. So depending at what point in that life cycle of this problem people come in, let's say they come in early and they just have some small spider veins. Injection treatment for spider veins today is great. Usually what I quote patients is that if we treat a certain area, that after one round of therapy, that should address about 80% of the veins that were treated.
Right.
What you're really seeing in spider veins is the blood. The veins themselves, you can't see them, you see the blood. So the idea about treating them is get the blood out and get those veins to kind of close in on themselves and turn into scar tissue, which is absorbed by the body.
I think we have some before and after photos that
Okay.
you had or brought up. Let's go ahead and take a look at some of these so you can talk. Here's a good example of spider veins. On the left, this is a patient before, and on the right, there's a visible difference.
Right. These before and after photos are probably at least three months or so apart.
Okay.
Once the veins on the left are injected, over the next few days, that whole area becomes a little bit red. The veins become a little bit more deep purple, a little bit darker, and a little bit raised also because you set up a very strong inflammation in the veins.
Right.
But that accomplishes a goal of forcing the blood out of the veins. And then as they heal over time, there's no blood within them and they are no longer visible.
Right.
Here's another set. These are a little bit larger.
How painful is that with the injections?
You know, most people read a book or just listen to music while we do these and really don't complain very much.
Okay.
The needles that we use are really the smallest ones that they make.
Yeah, okay.
This is another patient. Now, this
Wow, there's
patient's
a
little
huge difference here.
Yeah, and this is more interesting because she also had the venous insufficiency problem.
Right.
She didn't just have some spider veins on her legs. And so her treatment consisted first of laser therapy for her saphenous vein and some other veins that were not working right in her legs. And then after the circulation was fixed, that allowed us to directly go after her spider veins and inject them to get this improvement for her. This was a young girl, probably in her early 30s, as it turns out.
Early 30s.
Yeah.
Wow. Okay. And how many treatments are you talking about during this time? Does this depend on the case-by-case basis?
Yeah, each area usually we'll have to treat once and then maybe do a small touch-up for those 20% of veins that don't completely disappear. We usually do a 20-minute session for spider veins, but it's important for people to remember that these sessions don't eliminate the veins immediately. We often will have someone come in on a Thursday trying to get ready for their beach trip on Friday and want to get rid of their spider veins, and that doesn't work unless that Friday's in a few months.
Exactly. Good point. You got to plan ahead, folks. The specific lasers and the equipment and the machines that are out there now, how important is that to you? And obviously you have to, because I'm sure these big companies want to sell you everything they have.
Right.
For your practice, you want to pick the ones that you're most comfortable with and the ones that you think are the most effective, right?
Yeah. And there are two different really groups of lasers when you think about vein treatment. And we can start with the groups of lasers that take care of spider veins. So these use light to deliver energy to the blood in these little spider veins, literally vaporizing the blood and damaging those veins to make them go away. Those work great for spider veins in the face. Spider veins in the leg, however, typically do better with injections, unless you've just got a small patch of very small, fine red ones. Those do well with laser. But if there's any component of a larger vein or any kind of what we call feeder veins with the spider veins, injections do much better. So we do offer laser therapy for spider veins of the face and very select cases on the legs. The other group of lasers that we use is a laser fiber that goes inside of a vein and seals that vein off. We use a high frequency laser because that's associated with a lot less pain and bruising during and for the first 2 days after the procedure.
Right.
And this is a procedure that we do to treat chronic venous insufficiency.
Wow. All right, let's go to Linda real quick for our next break. Hey, Linda, thanks for calling in.
Yeah, I have a question.
Sure.
If someone has had a previous DVT, has been diagnosed with factor V, and has problems with varicosities, are they a possible subject for surgery?
That's a great question. We see people all the time who have had previous deep vein thrombosis and have the current problem of varicose veins and swelling. And there was a large study done on patients with both of these problems that showed that it is very beneficial to these people to treat their superficial vein disease, even though they have either a history of or even chronic deep vein thrombosis. The important thing when it comes to expectations is to understand that any leg that has had a deep vein thrombosis in it in the past, that sets the leg up for chronic swelling and chronic discomfort.
Right.
And so even if you have varicose veins that are successfully treated, that leg may still never feel as good as the other leg, but it will be optimized and the circulation will be corrected as much as it can be. And these expectations are easier to hone in on and be more specific with after an ultrasound, because the ultrasound will show us both the systems we talked about, the deep and the superficial.
What are the causes of this? Is it diet, exercise? Is it genetics and heredity?
Yeah, it's a great question. The most common cause of this, the most frequently noted or listed risk factor is heredity. So anybody who comes in with large, bulgy varicose veins, the odds are they have Thanksgiving dinner with somebody else who's got long pants on for the same reason. A lot of people come in the office and they'll say, well, you know, like for instance, I sit all day or I stand all day. And while that is not really a risk factor per se, because everybody does that. Most people that both of us and anybody watching probably knows spend most of the day either standing or sitting or walking on their feet, not laying down. And so while gravity does pull the blood down, really everybody deals with that, and most people's veins can hold up.
Yeah, interesting. All right, we're going to take another break, everyone. And when we come back, we'll take more of your phone calls at 737+, and we'll talk a little bit more about spider veins on the face and some of the treatments available for that. Stay with us. There we go. All right, we're back, everybody. Dr. Siragusa is with us as we continue, and wide open phone lines if you'd like to call in. We've gotten some great, really interesting calls so far tonight, so we hope you'll take advantage and call in tonight. Before, we were talking about spider veins on the face, of which I am a patient of sorts. I've got them too, burned. I've been told I burned a lot. This is sun damage coming back to haunt me, which I tell kids, please wear your sunscreen. What are the treatments right now? And it's not just like for me on my nose, but I know people have veins all over their face.
Right, and with the face, there's a range of this that can range anywhere from a few small isolated spider veins around the nose, on the chin or the cheek area, and that can range from that all the way to what's called rosacea, which is basically someone who has a very hypervascular face and they've got red cheeks and are always flushed, and with a background of spider veins with that. And most of the most effective treatments for that are light-based, and so that's using different different wavelengths of light to target the pigment in the blood and cause it to heat up and damage the actual vein, to where hopefully no more blood will come back into the vein. Some of them are a little bit larger, and like we were talking about, the nose is very vascular, the face is very, very vascular, and so oftentimes blood will work its way back into these damaged veins. So injecting them is also an option for recurrent veins after treating with a light-based therapy.
And when you talk about rosacea can really be difficult on someone's self-esteem, their quality of life in general.
Right.
How far have we come with treatments recently?
We've come very, very far with that. There are some treatments now. The one that we prefer is called BBL, which stands for broadband light, and that utilizes a very specific segment of wavelengths that you treat the whole face, and it addresses the reds in the face. Most people require 2 to 3 treatments. Each one takes about 30 to 45 minutes. There's really no downtime after these types of light-based therapies, in that patients may look a little bit more red than their baseline as soon as you're done, but after about 30 or 45 minutes, they look about normal. We wait about 2 weeks to do their next treatment, and we've had great results with that.
I'm glad you're on tonight, because we just did a story earlier on News Channel 5, unfortunately, about a patient who went into a specific, she went and had laser hair removal, and it went very wrong. She had some major issues, and the person who was administering it, I don't believe was a doctor. And we're hearing more and more. I mean, if you pull up Groupon or Living Social or any of these discounts, you see all these med spas that are offering vein removal, lasers and this and that. Why? Tell us again why it's important to go to a real doctor, a specialist who works with this and specializes in it.
And it's very interesting, and a lot of it comes down to some legal facts. When it comes to running a medical laser, the regulations for such use vary by state. Yeah. Some states, only a medical doctor can actually run the laser and use it on a patient. Other states, which are at the other extreme, patients can be treated by anyone who can speak English, really, who is actually approved by the supervising doctor to be the laser person. And Tennessee is on that end of the spectrum, in that we could open up a laser shop, and I could have you come by in the mornings and do lasers on people, as long as I deemed you qualified. And what that allows, it does allow you to get your costs down, but it also at the expense of getting your quality down as well. Yeah. And so anybody looking for treatments like that, I would recommend seeking a specialist's opinion and expertise, because these therapies can be very dangerous.
And what is the difference with someone like you? You're a vascular surgeon. There are also some very good dermatologists out there, board-certified dermatologists who are working with lasers, and then there are cosmetic surgeons as well. Does it depend on the specific issue you have as to who you should go see, or I know maybe you're biased toward the vascular surgeon part, that someone should come to you if they've got some cosmetic issues? Right. I think anybody that's trained and put the time in, has invested in the proper equipment, and has the credentials is a safe person to see. Vascular surgeons, dermatologists, certainly plastic surgeons are all on that list. What are some of the most, getting away from the cosmetic side, some of the most serious medical issues that you've dealt with as far as patients coming in? Anytime. I mean, today we had a patient. Someone who comes in and you're glad they came in, because if they had waited much longer, it could be very dangerous. Today we had a patient who came in who was working out this morning and all of a sudden developed pain in his foot. 2 hours later, he couldn't move his foot or wiggle his toes, so he came in
because he was concerned about his circulation. And as it turned out, this patient has an aneurysm in his aorta. And the main thing that aortic aneurysms can do is pop and kill you.
Yeah.
They can also have clot that forms inside of the aneurysm, and that clot can break off and go down to your leg. So in his situation, he had a piece of clot that broke off from his aorta.
And you could tell this from the ultrasound?
From the ultrasound and talking to him and examining his leg. So yeah, we took him this afternoon for emergency surgery, and we're able to get all the clot out and reestablish flow to his leg, and we'll probably fix his aneurysm in a week or so.
Pretty lucky person.
Yeah, he made the right choice. The people do so much better when they come in early with this problem. Any especially acute or sudden onset of pain in one leg that is not like any pain you've had before with your ankle or other issues is something that should be taken seriously. And if it doesn't go away after an hour or so, you should think maybe it could be a circulation problem.
Yeah, it's pretty frightening to think about that, and really just to trust your judgment. You know, you're the best judge of your own body. You know, yeah, exactly.
If it doesn't seem right, it probably is not.
What was the age range of this?
This patient is 64.
64. Wow. All right, 737 plus if you would like to call in as we talk about vein disorders and cosmetic treatments as well for veins. It is definitely something that we see a lot of advertising for. There's a lot out there, but we want to kind of separate fact from fiction with Dr. Siragusa tonight. Spider veins themselves are purely on the epidermal level. I mean, is that what we're talking about? Just the ones that are visible,
just
the
below
real
it.
small ones? Okay.
Yeah, those are just below it. And those can be classified also as either primary spider veins, which means those veins in your legs have just gotten a little bit weak and became a little bit too big, and you can see the blood in them now. Or they can be secondary to chronic venous insufficiency, because those small spider veins are the last stop on this branch. So if you've got a large vein in the leg with blood moving backwards through it, that blood just keeps backing up in that system until it gets to those tiny spider veins and causes them to become more visible.
Is this something, though, that just specifically comes with age? You know, I went to my high school reunion last year, and we're all kind of, you know, now that we're at this certain age, we're talking about all of our ailments, you know.
Sure.
But, you know, I noticed some of my friends, there are certain specific areas on the face where you can see where, and I'm thinking, is that from sun damage? Why is it up here by the eyes? Why is it on the nose?
Yes,
it's maybe some.
And so those patterns do point to sun damage, just because most of us are sitting like this, not laying down or us doing handstands, and so the sun is coming at us from above. Right. So if you shine a light on yourself from above and you see the areas where that light hits, that's where a lot of this sun damage is done, and it does cause not only the spider veins like we were talking about earlier, but also brown spots. That's a very
the dreaded brown spots.
The dreaded brown spots. They're called, some people call them age spots.
Age spots. Yeah, but those are also, there are some treatments, laser treatments, to help reduce or diminish those as well. Right.
There's some great treatments, again, with no downtime, to clear up almost all of those brown spots.
A lot of your patients, are they just looking you up in the phone book, so to speak, or online and coming in, or are you getting referrals from primary care physicians as well?
It's probably about a third of our patients come as a referral from another doctor who we've taken care of their patients for many years, and they send us this kind of problem. Probably a third of it is actually friends and family of current patients, and maybe another third is through media, advertising, and things like that.
Great. All right, we're going to take a break, everybody. When we come back, we're going to talk a little bit more about varicose veins as well, and take some of your calls if you'd like. 737 plus. We'll be right back. We're back, everybody. Dr. Tiff Siragusa is with us, and we are talking about vein disorders tonight and also some of the treatments available. And before we went to break, we wanted to talk a little bit more about, we talked about spider veins and a lot of the cosmetic treatments, and the doctor's been great in explaining all of these systems and disorders to us. But varicose veins, we're kind of in what you said to me in the break, stage 2.
Right.
Right, when we're treating these. And I know we have some photos to go along, but tell us a little more about this next level here.
Sure. So varicose veins, which are bulgy veins that
Right.
can stick out through the skin, those are often the result of venous insufficiency in a vein that you can't see. So the veins that you do see, these bulging varicose veins, what they're trying to do is deliver blood into another vein that will then take it up to the heart. When that kind of intermediary vein is not working right, blood moves backwards through it, comes out these branches, which become these big varicose veins. And so the treatment for this is based on the ultrasound that we do to evaluate our patients. The ultrasound will show us which vein or veins are not working properly, that are what we call leaking and allowing blood to move backwards. And once we identify the veins that are not working properly, we seal those off using either laser or radio frequency energy, depending on a few different factors. And that fixes the circulation problem pretty much immediately.
It's a pretty dramatic improvement here.
This is a patient these are all patients who had either radio frequency ablation or laser ablation of what's called the great saphenous vein. That's the most common vein that can cause this problem. And most of these patients also probably had either injection therapy afterwards or another procedure called a microphlebectomy, where the small veins are removed through tiny needle holes.
Wow, and there's another huge difference there.
Right, that was one of our male patients who was a fireman who had a lot of swelling and pain in his leg by the end of the day, and came in finally just because it was hurting him so much. He's been dealing with the visible veins. He had been dealing with the visible veins for a decade or so, but never really cared about that part of it. But once they started hurting him and affecting his ability to work, then he sought treatment for it.
Sure. All right. Fascinating pictures there. 737+ if you'd like to call in. Maybe you've dealt with this issue yourself and you may have a question. We are taking your calls. So then we get to these ulcers, right? They're called what?
Venous stasis ulcers.
What are they?
So this problem of venous insufficiency deals with the superficial veins, which, like we discussed earlier, drains blood from the skin.
Right.
So just picture you've got arteries bringing blood to the skin. They drop off oxygen and nutrients, and then they get into these small veins, which coalesce into larger veins and get that blood back to the heart. Well, if that system for removing the blood is not working right, over time, as the pressure in that system builds up, the blood in those small veins in the skin actually literally leaks out of the veins into the skin and can cause brown spots. This is most common above the inner ankle. So anybody with symptoms that include swelling, fatigue in the legs, pain, and the telltale sign is this discoloration above the inner ankle and in that area there. That's often a first sign of venous insufficiency. As that discoloration gets worse, people start to notice that the skin in that area, if they hit it or if they bump it, it doesn't heal very well. And then they will develop spontaneous wounds in those areas, because if the old blood's not getting out of the skin, you can't get new blood in.
Right, that makes sense.
Yeah, and so that problem is very, very often mistreated. Oftentimes, these people will be seen by treating physicians who will just give them antibiotics or maybe just do wound care.
Because they think it's an infection?
Because they think it's probably due to an infection or that it's just a non-vascular related wound. Although this area, especially between the knee and the ankle on the inner side, is really almost always going to be vein related.
Right.
Yeah. And so if you can correct this problem of all this what's called venous hypertension, where the blood backs up and causes this swelling and damage to the skin, if you can correct that, then almost immediately you set the skin up to heal. It's really amazing the response people have. Not only the ulcer healing time, but just the quality of the skin in that area around the ulcer improves almost immediately.
Right. And then you have some pretty happy patients.
Oh, yeah. Especially
Because of
we
the
have
difference.
some people who have been dealing with dressings and therapies for years for these wounds, and they'll go away
Unbelievable.
for a week or so, and then something else happens and it starts to come back, and they'll deal with it for another 6 to 8 months, and then they'll get it to heal for a couple of weeks, and it's just a recurring cycle.
Right.
It becomes their it takes their life over.
So you have 2 centers.
Correct.
Locally. Tell us a little bit, where are they?
So we have one center on Richard Jones Road in Green Hills,
Yep.
and our other office is located on the campus of Summit Medical Center in Hermitage.
Okay. So both sides of town
Both sides of
covered.
town.
When someone goes in, makes an appointment, take us through what they might expect.
Sure.
A new patient who comes in wants a consultation.
Right. Like I said earlier, a lot of people don't really know what's wrong with their legs. They just know they hurt or they've got a problem. And so for those people who want to come in just to get an opinion on what's going on with their legs, we offer free consultations. And those really consist of about a 5-minute or so meeting with either me or one of my nurse practitioners. And we'll evaluate the patient's leg, talk to them, and let them know what's likely going on with their legs. If it looks like a vascular problem, at that time, we can set them up for a full visit as well as an ultrasound study at the same time. That way we can get to the bottom of it as quickly as possible.
How quickly, at this stage in your career, having worked with so many patients, when you walk in and you take a look at an issue on a patient's leg, how quickly can you're pretty sure?
Before I tell them my name.
Really?
Yeah. You
Right
can,
away.
Yeah, it's one of those things that with after seeing so many legs and talking to so many people and having so many patients and looking and performing so many ultrasounds,
Right.
you know what correlates to what, and you can usually walk in and predict what the ultrasound will show. Oftentimes, this is blood moving backwards down the leg. So patients with varicose veins will come in and they'll ask me if I think I know what's going on. And I'll say, well, let's lay you down, we'll lift your leg up. And they'll lay down, put their leg up, and the veins disappear because now gravity's getting that blood back to their heart. And I'll put my fingers over the vein that's not working properly up in the thigh, and I'll keep it there as they stand up. And when they stand up, there's still no varicose veins. And I'll wait a few seconds, and then as soon as I let go, and then they feel it. They say, "Oh, my leg! I can just feel all that blood rushing to my leg." It just I said, "So I think I know where your problem is."
Remarkable.
Now you do too.
Yeah, really remarkable. All right, 737. We just got about 3 or 4 minutes before we go to the break, but if you'd like to call in, we'll fit your call in. Let's take a look at a few more pictures that we have, and this is the ulcer, the really advanced stage. I mean, this to me just looks like a wound. I mean, it really is a serious issue.
Somebody would think you just scraped your leg on a coffee table or something, but this wound developed really without any trauma. This was the first day that we evaluated the patient. We actually were able to do his treatment the next day. This photo is a week after, and you can note the difference in the skin quality around the ulcer, and also you can see that the wound itself has those islands of redness in there, which is the skin actually growing from the inside out. And that's 1 week after his treatment. And this photo is now 2 weeks after his treatment. You can see the area where the ulcer is almost completely healed. At the top left area there still is a small residual spot, which I think will be gone by next week.
Wow.
He also noticed things that he didn't expect he would notice. For instance, today we actually saw him, and he said that he used to have a lot of itching in his leg in that area, and the skin used to feel very tight and hard, and he's noted that has begun to correct itself as well.
Wow,
so
a lot of different issues that are being addressed with these treatments. And how long would you have to see a patient like this?
So for somebody like this, vein disease, because it's very hereditary, it tends to recur. Most people after a couple of years, probably about a third of them will have some new vein problem. And so especially patients with the more advanced vein disease like venous stasis ulcers, after he's healed up, we'll see him at 3 months, at 6 months, at a year. If at his year visit he looks like he's doing great, feels great, then we just go to yearly follow-up with ultrasounds.
Right. Excellent.
Yeah.
So you have a website.
Yes.
when people go to your website, what exactly are they going to find? Is there information there? Can they prepare before they come in for a consultation, maybe do
Right.
some paperwork, or is there just general information about your practice?
We really set our website up to be informational.
Yeah.
And so I like to have every type of information on there for patients when it comes to what to expect from us, who they're going to meet. We have a lot of our staff bios on our website. They want to know what's it like coming to see us, and they want to hear that from people who had their same problem. So we have several video testimonials of patients who had everything from small spider veins to venous ulcer disease, talking about the experience. And also, our website also gives a patient an opportunity for a free screening. And by completing a few questions and then identifying a photograph that looks most like their leg, they get an opinion on what they likely have wrong with them, whether it's spider veins or varicose veins or venous stasis ulcer. And at that point, they can also request a free consultation to confirm that and to discuss it.
And, you know, like we've said, there's a lot of cosmetic issues here, and some people may come in just because they're embarrassed.
Right.
But then they find out that they're glad they did, because this could lead to something
More serious.
something
Yeah.
real threat to their health.
Right, and the patients who are concerned with the look of their legs, a lot of them we'll see who have had multiple treatments and are not getting any better. And it's either they're not being treated appropriately, or they do have venous insufficiency, which is causing their problem that needs to be addressed first.
Fascinating. All right, we're going to take our final break, and we're going to share some contact information. Have a pen and paper ready where you can visit Dr. Siragusa. Stay with us.